Morning.
I'm just going to tuck this in right here.
Sure.
John, you should stand over here.
We got everybody? Hello and welcome, and thanks to everybody for being here today. I want to start by thanking my friends for joining me to make this important call to action at this defining moment in our country. Senators Tammy Baldwin, John Ossoff, Elizabeth Warren, as well as Majority Whip Jim Clyburn and Representative Carolyn Bordeaux. I've been fighting for a long time to close the coverage gap in Georgia. I've even been arrested for it. And for me, that was a small price to pay because in Georgia and in too many other places, people are still dying and going without care simply because of where they live. And every Sunday morning, I preach in honor of one who spent much of his ministry healing the sick. Somehow in the ministry of Jesus, there was a sense that if you heal the sick, you heal the land. That we get closer to God's dream for the land. And so we stand today because expanding Medicaid is the single most effective solution to closing the coverage gap in Georgia and the 11 other states who continue to refuse to expand Medicaid. Let's be clear. We push for the expansion of Medicaid because that's what Georgians voted for. When they sent me and John Ossoff to the Senate, and that's what the American people voted for when they gave us the majority. And now we owe it to them to deliver this legislation that will literally help save lives. That's what we're talking about today, saving lives. Now, I believe that health care is a human right. And if you believe that health care is a human right, you don't believe it's a human right in just 38 states. Can you imagine Social Security in 38 states? Medicare in 38 states? It's unimaginable. It's unimaginable because now we all know that Social Security is the law of the land. Medicare is the law of the land. And 11 years after it was passed, the Affordable Care Act is the law of the land. And so we have an opportunity now to close the circle and write the final chapter. No one should be denied health care in America because of where they live. Now, I know that there are a number of priorities being discussed in this package, all focused on health care. But whatever we do, we must expand Medicaid. People are literally dying, especially the working poor, because they have no access to health care at all. That is unconscionable and unacceptable in the United States of America. And so we're here to say that a comprehensive, stable Medicaid fix, like the provision currently in the House package, must be in the economic package if we're serious about saving lives, improving health outcomes, strengthening public health as we work to come out of this pandemic, and growing our economy. This pandemic taught us lessons that we should have learned a long time ago. When you're dealing with a highly contagious airborne disease, if your neighbor is sick, you're potentially imperiled. We're as close in our humanity as a cough. A virus doesn't know geographical boundaries, certainly doesn't know state lines. The pandemic is teaching us what we should have known, and that is that we need to make sure that all Americans, the 4.4 million Americans and the 646,000 Georgians who qualify Medicaid expansion, are rescued from a hostage situation. Because that's what's going on right now. We have politicians who are blocking Georgians and others in the 11 other states from access to the health care that they're already paying for in their taxes. They're acting as if this is their money. It doesn't belong to them, it belongs to the people. This democracy belongs to the people. They put us in the majority. We ought to close the circle and expand Medicaid now. With that, I'll turn it over to my brother, Senator Ossoff.
Thank you, Senator Reverend Warnock, as always, for your moving words of wisdom. Thank you even more, Senator Reverend Warnock, for your extraordinary leadership to secure Medicaid expansion for the people of Georgia and for Americans across this country in states that still refuse to expand Medicaid. We have the chance now to make a huge difference, to save lives, to spare our fellow citizens from needless suffering and death by ensuring that this economic legislation include Medicaid expansion. And so I join these esteemed colleagues, Senator Warren, Senator Baldwin, the whip. It's an honor to be here with you, my dear friend from Georgia, Representative Bordeaux, and of course my brother, Senator Reverend Warnock, to urge our fellow members of Congress to heed the will of the people, to listen to the voices in Georgia who elected me and Senator Reverend Warnock to secure this Senate majority, and to include Medicaid expansion in reconciliation to ensure that every American has access to the health care that they need, to end the needless suffering and death by America's working poor in states where politicians, out of contempt for low-income people and vain partisanship, refuse to do what's right and sentence so many to needless suffering and death. In Georgia, we've lost 9 hospitals in the last 11 years. Senator Reverend Warnock and I campaigned in Cuthbert, Georgia. Their hospital closed in the middle of this pandemic. Can you imagine? The only hospital for hours around in your community closing in the middle of a pandemic. And these hospitals in Georgia have closed in large part because our state political leaders have refused to expand Medicaid. I met a woman in Cuthbert last year whose brother experienced a medical emergency on Thanksgiving, had to be rushed to Columbus, Georgia. That's over an hour away to treat that medical emergency. And even folks who live in communities where the hospitals have stayed open can't afford the care, can't access the care because Georgia has refused to expand Medicaid. We have the chance now in Congress to change that. We have a moral imperative to expand Medicaid. As Senator Reverend Warnock said, access to health care shouldn't depend on where you live or who you are. Health care is a human right. We can make that a reality across this country by taking action now. It's my pleasure to welcome my dear friend, Senator Baldwin.
Thank you so much.
Well, good morning, everybody. And I want to start off by thanking my colleagues, Senator Reverend Raphael Warnock, John Ossoff, for being steadfast partners in the fight to save lives and expand necessary health care coverage to some of our most vulnerable citizens. As many of you know, Republicans in 12 states, including the state of Wisconsin and Georgia, have refused to fully expand Medicaid coverage through the Affordable Care Act. For nearly a decade in Wisconsin, Republicans in the state legislature have rejected federal investments in Badger Care, our health care coverage program for low-income Wisconsinites. It would make, had they expanded Medicaid, 91,000 Wisconsinites eligible for high-quality health care. Wisconsin Republicans have turned away in total over $1.6 billion in federal funding that could provide Badger care coverage for some who are currently uninsured. To put this in perspective, that means they are denying the quality coverage that Badger Care provides to someone working and only making $13,000 a year. Only $13,000 a year. And that's just wrong. I teamed up with my colleagues from Georgia so that we could open the door to those who have been shut out and expand access to affordable health care, including preventative care that people want and desperately need. Waiting for Republicans in the Wisconsin legislature and the 11 other states that have refused to do the right thing is no longer a viable option. Our Build Back Better budget is the best opportunity we have to make a federal investment to expand access to quality health care coverage for working families. By closing the coverage gap, studies show that we would save an estimated 7,000 lives each year and could reduce $2 billion of medical debt. Health insurance isn't just about coverage. It can improve so many different aspects of a person's life. And right now, we have the opportunity to get it right, guided by our belief that health care should be a guaranteed right in America. In light of one of the greatest public health crises in the last century, a crisis that has had a disproportionate impact on our most vulnerable communities, it is time to act now. We must make sure that we provide affordable quality health coverage to 91,000 people in Wisconsin and millions more who have suffered under Republican legislative obstruction. The Build Back Better legislation that we are working to pass is focused on tax cuts for working families, lowering costs of child care, health care, home care, and prescription drugs, and creating good-paying jobs. Our budget legislation will make the wealthy and big corporations pay their fair share of taxes so that we can invest in the economic security of working families. And that includes making investments to expand health coverage. We face an urgent choice. Do we keep an economy that serves the wealthiest and biggest corporations, or finally give working families a fair shot? This is our moment to prove to the American people that their government works for them, not just those at the very top. I am so grateful for the work of my colleagues who join us today here and feel confident that we can get this done. And with that, I'm going to hand it off to the Majority Whip, my former colleague and continuing friend. Please welcome Whip Clyburn.
Thank you very much, Senator. I'm pleased to be here with you and with my friends, Senators Warnock and Ossoff and Warren, and my colleague, Representative Bordeaux, to add my voice to the plea that we make America's greatness accessible and affordable for all. When we first started debating legislation to deal with COVID-19, I made a statement to my caucus that we had an opportunity to do just that, to really do some things to fit within our vision that we enunciate every time that we pledge allegiance to our flag, with liberty and justice for all. That's the vision. We have an opportunity now to do that as it relates to health care. I often think, as I walk these halls, about my mother, who passed away at the tender age of 55. She suffered from multiple myeloma. And if you know anything about that disease, at the time of her passage, there was absolutely no cure. Science had not advanced far enough to give her a good quality of life in her waning days. This is not just about saving lives. This is about enhancing the quality of life. And it's one thing for us to guarantee dental care, vision care, for those of us who advance beyond the age of 65. It's something else to say to an 18-year or 19-year in a family that has income below the poverty level, who aspires to the middle class, that if you get a toothache or if you need vision care because your state did not expand Medicaid, it's not available to you. That is what we are allowing in 12 states that have decided not to expand Medicaid. That is not who we are. We, as my late colleague Elijah Cummings would say, we are better than that. And it's time for us to demonstrate that we are better with this legislation to do for the people of those 12 states what their governments decided not to do. That has been the history of this country. That is how I stand here. And Warnock standing is because the federal government decided it would not leave it up to the states to decide how much of America's greatness you are deserving of. And with that, I'm pleased to yield to my colleague and my fellow warrior on behalf of student debt, Senator Warren.
We're going to get that done. Thank you. Thank you very much. I appreciate it, Whip. I want to thank Reverend Warnock for bringing us together here today. He is a true leader, and he makes his leadership count. And now he is here to lead us, to lead our Congress, to lead our country, to save lives. I also want to thank his partner in this effort, Senator Ossoff, who also demonstrates these qualities of leadership for the people, and Senator Baldwin, who is determined to be on the front lines to make change. I welcome our friends from the House. So glad that you are here, Whip. It is an honor that you would be with us to lift up this issue. And Representative Bordeaux, I am grateful to you for all that you do every day because it is right. In America, access to a doctor or a hospital should not depend on where you live. Getting cancer treatments or insulin to manage diabetes should not depend on where you live. Avoiding bankruptcy over bills from a broken leg or a child with leukemia should not depend on where you live. And yet, here in America, the richest country in the history of the world, care that is routinely available in 38 states is out of reach for millions of people solely because they live in one of the other 12 states. People who are caught in the Medicaid gap because their states stubbornly refuse the help offered by Obamacare don't get access to health care that millions of other Americans get. The Medicaid coverage gap has left low-income Americans, including those in rural communities and Black and brown communities, in the lurch. They make too much to qualify for traditional Medicaid and yet too little to afford private insurance. And make no mistake about the racial injustice that this gap inflicts on America. More than 60% of the people in the coverage gap are Black, Latino, or AAPI. Healthcare is a basic human right, and it is shameful that millions of Americans still lack access to healthcare because of where they live. But here's good news. We can make change. Reverend Warnock is leading us to a new time, a time when all Americans get access to affordable health care. He has shown us the way to permanently close the Medicaid coverage gap. And better yet, he is leading us to make these changes now. Healthcare inequality is a matter of misery and pain, and for some, it is a matter of life and death. Healthcare inequality is also about what is morally right, and denying access to affordable healthcare is a moral disgrace. I am honored to stand alongside Senator Warnock to introduce the Medicaid Saves Lives Act, a bill that would stand up a federal Medicaid program for people who are caught in the coverage gap. It is time to give people the coverage they have long been promised and to close the Medicaid coverage gap for good. And I am honored to be here with my colleagues to get that done, and particularly honored to be here with another great leader from the state of Georgia, and that is Representative Bordeaux.
Thank you so much. I want to start by thanking Senator Warnock for inviting me to speak this morning and for leading the charge on this important issue in the Senate. Additionally, thank you to the Majority Whip Clyburn, Senators Ossoff, Baldwin, and Warren for being champions of this very important cause. One of my top priorities in Congress has been ensuring that Americans of all backgrounds have access to quality, affordable health care. This is why I introduced the Medicaid Saves Lives Act in the House, and why I am so pleased that this legislation has been included in the House side in our economic plan. In Georgia's 7th District, across the state and around the entire country, too many people are unable to access the medical care they need due to the Medicaid coverage gap. Despite significant financial incentives provided by the Affordable Care Act and the American Rescue Plan, Georgia and the 11 other non-expansion states have still refused to act. Expanding Medicaid has the potential to provide health care coverage for 4 million Americans, and that includes 646,000 Georgians. We must change the notion that the state you live in affects your access to affordable health care. The choice in Georgia not to expand Medicaid has a very real human cost. I am always reminded of a man in my district who showed up at an outpatient clinic in excruciating pain. He was in so much pain that he could not even hold a pen. He was a day laborer at a warehouse, which means that he had a low income, and of course, in Georgia, this meant that he didn't have health insurance because Georgia did not expand Medicaid. He came in desperation to the doctors, who had to tell him that we are so sorry. You have advanced stage rheumatoid arthritis. If you had come to see us a few years ago, even a few months ago, we could have given you anti-inflammatory drugs that would have protected your joints, and you would still be working today. But now the disease has destroyed your joints, and there is nothing we can do but to give you painkillers to relieve your suffering. This was a man who only wanted to work, and they said it was sad. He went from station to station in the clinic asking if there was any work that he could pick up. And they saw him, and they was like, well, no, I'm sorry about that. The irony of this story is that now he's eligible for disability, and now he's eligible for Medicaid. As you may know, my background is in budgeting and public finance. This is fiscally irresponsible because it's a lot more expensive to pay for disability than it would have been to pay for the anti-inflammatory drugs up front. It's fiscally irresponsible because each and every one of us in Georgia who has health insurance, pays for the uncompensated care and our rising health insurance premiums. But fundamentally, it is morally wrong that we hang our working people out to dry in this way. And I have story after story like this. Women showing up with tumors that you can see through their breasts because they waited until late-stage breast cancer to show up to see a doctor. Men having strokes because they can't afford the doctor's visit to get the hypertension medication that they need. Parents of grown children with mental illness who cycle through our prisons because that is the only place in Georgia that they can get health care. The decade-long failure to expand Medicaid in Georgia has cost us dearly in lives and, of course, in expense. Over the past decade, I have written op-eds, memos, protested, posted on social media, and in no small part, I ran for Congress because of my frustration with Georgia's failure to expand Medicaid and the devastating consequences it has had on people's lives. Since being elected, I have worked with my friends in the Senate and a coalition in the House to provide financial incentives to persuade Georgia and other non-expansion states to expand, all to no avail. I am done with arguing, begging, and protesting. It is time to finish the job of ensuring that everyone has affordable, quality health care. It is time to close the coverage gap in Georgia. It is time to expand Medicaid. Thank you again to my colleagues for having me this morning, and I will now turn it over to my good friend, Senator Reverend Warnock, to take questions.
Thank you so much. With that, we are happy to respond to some questions. Yes.
I have two questions. One, I know you have a close relationship, obviously, with Democrats and leadership as well. What have conversations been like about getting this into reconciliation, about getting this included? And then two, I just was curious if you're disappointed about the police reform talks ending in the Senate.
Well, the caucus understands the importance of health care. I mean, that's what makes us Democrats. We believe that health care is a human right, and I'm encouraged by the conversations that we're having, and we're going to keep pushing to make sure that at the end of the day, this is still in the package. Listen, I, like many, I'm concerned about the issue around police brutality, and I think it's important that we keep the fight up. We didn't, we may be where we are at this point in this moment, but we're not about to stop fighting.
So you don't think it's over yet?
No, absolutely not.
Nobody's given up. Not on our side.
Yes.
I know nobody here was at the White House last night, but from conversations with your colleagues, you know, from what are you hearing? Was there progress made, and if so, where was it?
We're all Democrats, and we're all trying to move this thing in the same direction, and we're all trying to get to the same end point, and that is a package that works for the American people. We all understand that we need roads and bridges. We also need child care, and we need expanded access to health care, and we need to make a real down payment in the fight for climate change. So it's a lot of negotiations going on to try to get that done. The president is clearly putting his shoulder behind it. But keep in mind, this is the agenda that President Biden ran on, and it is the agenda by which he won by the largest margin in the history of the United States. So as Democrats, we are committed to getting this done. We will continue lots of negotiations with each other, lots of push and pull, but we are going to get there.
Yes.
So two-part question. First, just to ask again, how are you ensuring that this will be included in reconciliation, considering all of the other healthcare priorities that need to be addressed? And second, just for a point of clarification, how, if at all, would this bill affect those in the 38 states that have expanded Medicaid who are currently
It will
covered?
not impact them at all. It'll make the situation better for all of us. I mean, the problem is that we have this patchwork of care. And I've heard some who've said, well, aren't you somehow rewarding bad behavior by expanding Medicaid in the non-expansion states? That's the wrong argument. The issue is this, that the politicians in Georgia and in Wisconsin and other places are making this about them. And what we're saying is that it's not about them. It's about the people who are literally being held hostage in a cynical political game. And so to expand Medicaid in Georgia doesn't do anything to hurt folks in states that have expanded Medicaid. In fact, it makes the whole system stronger. Yes.
But I think one of the discussion stuff that I've been reading about was that this would be 100% fully funded by the federal government, whereas the states that actually expanded Medicaid are 90% funded by the federal government, and that's caused some issues in your conference. How do you address that where they're saying that it's not fair that these states who didn't expand get 100% paid for, but then these other states are paying not 90%, the federal government pays 90% and the states 10%?
We make bad public policy when we make it about the politicians. When I put forward this, I'm thinking about a nurse in Georgia named Lori, who ironically provides health care to people every day. That was her job. And she literally died for lack of access to health care. And so it's costing the non-expansion states, and it's costing the states that have expanded not to provide health care to every American. It's a moral and a human right, and it's the smart thing to do in the long run. With that, thank you so much.
Thank you all. Thank you. It's good to see you. Thank you.
Good job.
No, you definitely know what it is.